Welcome to Menopause 101. So let's get into some of the signs and symptoms of menopause and perimenopause, which we typically see with changes in menstrual cycle first, where again, this can vary. The period may occur less frequently, skipping months, or the bleeding pattern is more erratic, where there's bleeding in between periods. Maybe bleeding becomes lighter, shorter periods of time, or perhaps heavier bleeding can occur when the period does arise. Now, I kind of like to break down the signs and symptoms with what hormonal changes are occurring, and that being a drop in estrogen, progesterone, and testosterone. So, symptoms due to estrogen deficiency or a drop in estrogen typically would be hot flashes, the most common symptom, affecting about 80% of women experiencing menopause and can linger for some women decades after menopause, so in the postmenopausal period. Vaginal dryness, vaginal atrophy, which can lead to discomfort during sex, frequent urinary tract infections due to thinner vaginal tissue, less lubrication, cognitive changes, brain fog, forgetfulness, decreased concentration or memory due to drops in estrogen, bone loss, decrease in bone mineral density can occur during the menopausal period. Onset of cardiovascular disease. So, with the decrease in estrogen, there is an increase in risk of cardiovascular disease, which may be mediated by changes in the lipid profile during perimenopause. And so, because of this, it is best to do a more thorough cholesterol panel for women during this time of life. So, in addition to checking the cholesterol panel, also have your doctor check apolipoprotein B and high sensitivity C reactive protein, which are inflammatory markers as a means to assess your risk for heart disease and stroke. Now, something else that I've noticed with my menopausal patients, less frequently but evident, is the onset of palpitations. So during the menopausal period, and it is known that falling estrogen levels can trigger heart palpitations or abnormal heart rhythm. Of course, other things should be ruled out, such as thyroid disease and intrinsic heart issue, but estrogen deficiency may be the cause and hence perhaps warrant hormone replacement as an aid.